Hello and welcome to the Registry Partners Oncology Coding Break for February 2025. The topic is 2025 Standard Setter Updates. My name is Melissa Chapman and I'll be presenting for you today. Today's objectives are to review the 2025 NAACCR Implementation Guidelines. We'll review any new and revised SSDIs and go over the 2025 manual updates. The NAACCR Implementation Guidelines and recommendations provide cancer registries and software vendors with a plan to assist with the implementation of the NAACCR data standards and data dictionary in a timely manner. You can access this document at the link on the current slide. This document breaks down changes to coding for hospitals and central registries in a simplified format. It's also available to everyone. There are two new SSDIs for 2025, PDL1 and PTLD. PDL1 is for lung primaries only, or the C34 primary site. It's required for cases diagnosed January 1st, 2025 and forward. It is included in the lab tests and may also be included in the path reports or in separate reports from biopsies from the specimens of primary lung cancer. The absence or presence of PDL1 expression determines if the tumor will respond to treatment with targeted inhibitors such as immunotherapy. Post-transplant lymphoproliferative disorder, or PTLD, is collected for heme and lymph primaries only, such as lymphoma, CLL/SLL, plasma cell disorders, plasma cell myeloma, and primary cutaneous lymphoma. This is required for cases diagnosed January 1st, 2025 and forward. Lymphoid proliferation arising in a recipient of a solid organ transplant, allogeneic bone marrow transplantation, or an umbilical cord blood transfusion. And the patient must have a history of solid organ transplant or an allogeneic bone marrow transplant. There was one SSDI that was revised in 2025 for colon and rectum primaries diagnosed January 1st, 2021 and forward. The BRAF mutational analysis was modified to add code 3, and this is to capture abnormal mutation or detection of the KIAA1549 BRAF gene. The BRAF oncogene is involved in transmitting cell growth and proliferation signals from KRAS and NRAS, which KRAS and NRAS. The BRAF V600E mutation is associated with poor prognosis and predicts lack of response to anti-EGFR therapies. BRAF mutational analysis is recommended in clinical guidelines for patients with advanced colorectal cancer as prognostic marker and factor in determining appropriate therapy. It's the newest data item for cases diagnosed January 1st, 2021 and forward. We have several manual updates in 2025. The solid tumor rules, which is for cases diagnosed January 1st, 2018 and forward. There's an exception for melanoma, which was diagnosed from 2007 to 2020, and they must use the MPH 2007 rules. The other exception is for the other sites, which excludes specified sites that were diagnosed 2007 to 2022, and we must use the MPH 2007 rules for these diagnosis years. You can download the solid tumor rules at the link on the current slide. There is also a changelog available from previous versions, and that previous version is November 2024 update. And it is available as one consolidated manual only. There's no longer access to individual chapters online. There's some highlights for the solid tumor rules. Any references to NED, or no evidence of disease, were removed across all site modules. More subtypes and variants were added to tables across all site modules for histology. Multiple primary rules and histology coding rules were clarified for specified sites, and introductory notes were updated for clarification and readability. There were also a few changes for AJCC. We have the version 9, 4 new chapters that were available for cases diagnosed 1/1/2025 and forward. These include the thymus, lung, diffuse pleural mesothelioma, and the nasopharynx. The current version 9 chapters include cervix for January 1, 2021 and forward, the appendix, brain and spinal cord, and anus for 1/1/2023 and forward, NET appendix, colon and rectum, duodenum and the ampulla of Vater, jejunum and ileum, pancreas and stomach for 1/1/2024 and forward, and the vulva for 1/1/2024 and forward. There's new AJCC staging manual options that were released this year. AJCC Staging Online is now available for an annual subscription. The AJCC 8th edition and the 9th version chapters will be updated in real time and available within this website. There is a print version still available for 8th edition and 9th versions, and Kindle versions are still available for 8th edition and 9th version. And for more info, you can visit the website on the current slide. The 2025 STOR manual has been released. Revisions from the previous version of this manual are listed on page 1 and include additions and removals of text and instructions. For example, on page 264 through 267, they removed if chemotherapy was provided as a radiosensitizer or radioprotectant, do not code as chemotherapy treatment. This instruction is to now code the chemo agent whether or not it's described as a radiosensitizer. And there are other changes that are just as important to review. Summary Stage 2018 manual had a new published version, the November of 2024 for cases diagnosed 2018 and forward. Notes were restructured to add titles and improve readability only. There were no major changes to the content of this manual. The 2025 SEER Program Coding and Staging Manual was made available for cases diagnosed 1/1/25 and forward. A summary of changes is available beginning on page 9 and includes a reportable diagnosis list update, cancer path chart, site morphology combination standards update, data items added to the manual including SSDIs, and modifications to current data fields such as tobacco use, smoking status, or laterality. All links to the current manuals are available on the slide. The SSDI manual and grade manual version 3.2 were both released for cases diagnosed 1/1/2018 and forward, but it was requested that we do not use these manuals until version 25 edits have been installed in our cancer registry software. There are some changes with the new SSDIs that were added for 2025 and the grade clarifications. A changelog is available which provides a list of all changes to both the SSDI manual and the grade manual. Timing will vary by facility depending on vendors. You can continue to use version 3.1 until this event. Also available is the SEER RSA website version 3.2, and again, we are instructed to only use this when our V25 edits are installed in our software. You can use previous version 3.1 until version 25 edits are installed for SEER RSA as well. The Heme and Lymph database has been updated to incorporate the change of behavior of PTLD, post-transplant lymphoproliferative disorder, And again, PTLD was previously reported as 9971 behavior 3 for 2010 to 2020 when it was the only diagnosis. Now in 2021, based on the 4th edition of the WHO Hematopoietic Blue Book, PTLD became 9971 behavior 1, where it was only reportable if it occurred in the brain. Now, starting in 2025, PTLD as the only diagnosis will become a behavior 3 or malignant again and will be reportable for all cases. There were no updates to the ICD-03 except for that PTLD behavior change from 1 to 3. For case finding, there is a new 2025 case finding list available, and I've included the link to this document on the current slide. This is effective for 10/1/2024 through 9/30/2025. And remember to utilize these free resources when abstracting the C Answer Forum or the ACOS Cancer Forum. There is a link to access this website, and you can register for free. The SEER inquiry system also is available for all registrars. It does not cost anything, but it does require you to access the website and search. You can ask questions, and you can look up previous questions that were answered by other registrars. That's it for today. Thank you so much for joining. Have a great day.